Healthcare in America. It's complicated, expensive, and for millions, still out of reach. From the Affordable Care Act, Obamacare to Medicare, our system is under pressure. And with the 2024 election coming up, both sides have big ideas about what comes next. Right now, 35 million Americans rely on the Affordable Care Act, and 60 million seniors are covered by Medicare. But there are still over 25 million uninsured Americans, and many more are underinsured, stuck with so-called junk health insurance. Rising costs plus doctor and nurse shortages are leaving too many behind, and the pandemic made things even worse. President Biden's administration has made major strides in healthcare. Thanks to the Inflation Reduction Act, Medicare can now negotiate drug prices, saving taxpayers billions. Insulin is capped at $35 a month, and vaccines are free for people on Medicare and Medicaid. The administration is also cracking down on medical debt collection and junk health insurance, closing loopholes and eliminating hidden fees. Kamala Harris is pushing for even bigger reforms. Her plan includes expanding Obamacare, protecting Medicare for future generations, capping out-of-pocket costs, and controlling rising drug prices. She's also working to expand home health care services for seniors through Medicare, and wants to add vision and hearing care to Medicare coverage. She's making sure no one gets priced out of care, no matter their age, health status, or income. Now, Trump. He's been talking about repealing Obamacare for years, but hasn't offered a detailed plan, just concepts. His latest proposal? Deregulating the healthcare market and pushing people toward private insurance. The Radical Project 2025, written by Trump's team, goes even further, threatening women's access to healthcare, cutting Medicaid, dismantling Obamacare protections, and pushing for the privatization of Medicare, which will raise costs for everyone. And here's the dangerous part. Repealing or deregulating Obamacare means millions of Americans with pre-existing conditions, like diabetes, asthma, or even pregnancy, could be denied access to coverage. In 2024, we get to choose. Do we expand affordable healthcare with Kamala Harris, or roll it back with Trump and the Heritage Foundation? This election, your vote could decide whether healthcare is a right or a privilege for the few. For real, the risks are too big.
Vote!